Gentlemen, what if I told you that one of the most powerful ways to restore blood flow, improve sensitivity, and reignite performance wasn't in a prescription bottle, wasn't in an expensive clinic procedure, but is already accessible on your own body right now? Yes, I'm talking about a spot about the size of a coin that when massaged for just 60 seconds a day could bring back what you thought was gone forever. And here's the best part, you don't need any special equipment, no appointments, and it takes less time than brushing your teeth. Now, before I show you exactly where the spot is and why it works, do me a favor, hit that like button. If staying strong and vital after 50 matters to you, leave a comment below and tell me where you're watching from. I love seeing men from all over the world supporting each other, and subscribe so you never miss a video on men's health, vitality, and confidence. Alright, let's talk about the truth behind this hidden spot. Most men believe that after 50, performance issues are just part of aging. They think blood flow slows down, testosterone drops, and intimacy simply becomes more difficult. So, they either ignore it or reach for a little blue pill when things don't cooperate. But here's what most men don't realize. Age isn't the real enemy. The real problem is pelvic tension and poor circulation over years of sitting, stress and inactivity. The muscles of your pelvic floor, the ones that control erections, urination, and even sensation, become tight and weak at the same time. Picture an old rubber band, it's stretched out, tight, but it's lost its snap. That's exactly what's happening in your body. Your blood vessels stiffen, nerves get compressed, and suddenly what used to happen naturally now requires effort or doesn't happen at all. But here's the good news. By releasing tension and stimulating circulation in the right spot, you can literally rewire this system, and the spot I'm talking about has been recognized for centuries in traditional medicine. But modern science is finally explaining why it works. But before I reveal the exact technique, let me tell you about the 3 biggest mistakes that are keeping men stuck. For those of you who are new here, I'm Dr. Sophie Morgan, a board-certified urologist with over 10 years of clinical experience helping men in their 30s, 50s, and 70s regain vitality, confidence, and health without unnecessary drugs or procedures. I've seen firsthand how small natural interventions can bring back energy and intimacy men thought they had lost forever. And today I want to walk you through one of the most underused yet powerful techniques available. Perineal massage, or what some traditions call the $1 million point. Now let's talk about the mistakes that block your potency. Mistakes this massage helps reverse. Mistake number 3, ignoring pelvic tension. Most men don't realize their pelvic floor muscles are chronically clenched. Stress, long hours sitting, even holding in urine. All of it makes those muscles lock up. What happens? Blood vessels compress, nerves dull, and circulation slows. This massage helps release that hidden tension, like unclogging a tight knot that's been strangling your performance. Biologically, you're decompressing arteries and nerves. Emotionally, you're releasing years of stored stress. Practically, 1 minute a day can restore what pills only mask. Mistake number 2, relying only on pills. Pills might help in the moment, but they don't fix the root problem. They force blood flow temporarily, but they don't restore flexibility in your vessels or strengthen your nerves. That's why men find the effect wears off. This technique, on the other hand, retrains your body naturally, building real lasting improvements. Think of it as the difference between a crutch and physical therapy. One keeps you dependent. The other rebuilds your natural function. Mistake number 1, believing age equals decline. The biggest mistake is giving up hope. I can't tell you how many men in their 60s and 70s I've treated who thought they were too old until we restored blood flow and sensitivity. Within weeks, their confidence and their intimacy was back. Age is not a death sentence for your vitality. It's a signal that your body needs attention. Now, if you're still with me and this is making sense, do me a quick favor. Hit that subscribe button right now so you don't miss the next videos where I'll show you other natural techniques to support your vitality. And drop a comment below. Tell me which of these 3 mistakes hit home for you. I read every comment. Alright. Now here's where it gets practical. I'm going to show you the exact technique step by step. But first, let me answer the question I know you're asking. Where exactly is this spot and how do I know I found it? Step 1. Find the perineum and locate the exact spot. The perineum is the area between your scrotum and anus. To find the precise location, place your fingers about 2 to 3 centimeters back from the base of your scrotum, moving toward your anus. You're looking for a spot that feels slightly softer than the surrounding tissue. Here's how you know you found it. When you apply gentle pressure, you should feel a mild tenderness or slight tension. That tenderness is actually a good sign. It means you're pressing on the exact location where tension has been building. Don't worry if it feels a bit sensitive at first. That sensitivity will decrease as you massage regularly and release the chronic tension. Step 2. Position yourself comfortably. Sit on the edge of a chair. Lie on your back with your knees bent or stand with one foot elevated on a stool. The goal is easy access without straining your wrist or hand. Find what works for your body. Step 3. Apply the right pressure. Use your index and middle fingers. You have 2 options here. You can press down about 2 to 3 centimeters deep for internal stimulation of the prostate area, or you can massage externally for 60 to 90 seconds with lighter circular pressure. The pressure should be firm but not painful. Think of pressing on a ripe avocado. You want to feel resistance, but you're not forcing anything. If it hurts, ease up. This is about circulation, not aggression. Step 4. The massage technique. You have several effective options. Small circles, 30 seconds clockwise, 30 seconds counterclockwise. This creates a pumping action that moves blood through the area. Or try press and release. 5 seconds of firm pressure, then relax and repeat. This mimics the natural rhythm of blood flow or gentle up and down pulses that feel like you're manually pumping blood into the tissue. All of these work. The key is consistency and rhythm. You're stimulating dormant nerves and waking up circulation that's been compromised for years. Step 5. Use the right oil to supercharge the effect. This step is optional, but it can dramatically increase your results. Castor oil penetrates deep into tissue, improves circulation, and reduces inflammation. Coconut oil is gentle, antibacterial, and supports hormone balance. Black seed oil, legendary in Middle Eastern medicine, is known for boosting testosterone naturally. Warm the oil between your hands before applying. Cold oil on sensitive skin is unpleasant, and warmth itself improves blood flow. Step 6. Timing and consistency. Do this once a day. The best times are in the morning when testosterone is naturally highest, or in the evening to relax your body and improve nighttime and morning erections. Here's what you need to understand. Consistency beats intensity. 1 minute every day is infinitely better than 10 minutes once a week. Treat this like brushing your teeth. It's a daily habit that compounds over time. Now, before I share a real patient's story, let me give you the honest timeline so you know what to expect. In the first 1 to 3 weeks, you'll notice relaxation in your pelvic area, reduced muscle tension, and more comfort when sitting. You might not see dramatic changes in erections yet, but you'll likely notice improvements in lower back pain, hip flexibility, and bladder control. Your body is adjusting. Your nervous system is recalibrating. Between weeks 4 and 6, this is where most men notice real change. Studies show that about 40% of men experience significant improvement in erectile function during this window. Things start working more easily, they last longer. Morning erections return, confidence comes back. By weeks 8 to 12, results stabilize and become your new normal. And here's the best part. Benefits can last 6 to 12 months, even after you stop, especially if you continue basic pelvic floor exercises. But remember, this only works if you're consistent. Daily massage is far superior to occasional longer sessions. Now, I know some of you may feel awkward even hearing about this. Maybe you've never touched this part of your body before. Maybe you're thinking, is this really for me? Let me be very clear. Yes, it is. This isn't strange. This isn't shameful. This is about restoring function, dignity, and freedom. And if this information is valuable to you, show your support. Hit that like button so this video reaches more men who need it. Your engagement helps us grow this community of men who refuse to accept decline as destiny. Let me tell you about one patient who showed me just how powerful this can be. His name was Michael. He was 62 years old, married for 35 years, and when he came into my office, he looked defeated. He told me he'd given up on intimacy completely. He and his wife barely touched anymore. He felt like a failure as a husband. He'd tried pills, but they only work sometimes, and the side effects made him feel worse. He thought his body had betrayed him. I taught Michael this exact massage. 1 minute a day, perineal pressure with castor oil combined with basic pelvic floor exercises. For the first 2 weeks, nothing changed. He almost quit, but I told him, Michael, your body is relearning. These muscles have been locked up for years. Be patient. In week 3, something shifted. He woke up one morning with a partial erection. It wasn't much, but it was the first time in 2 years. By week 5, he was waking up with full morning erections again. But here's what really surprised him. Not only did his function improve, but his chronic hip pain disappeared. His bladder control got better. He had more energy during the day. He felt more like himself again. 2 months later, he came back for a follow-up with his wife. They were holding hands. She looked at me and said, "Doctor, you gave me my husband back." Michael told me, "I didn't just get my body back. I got my confidence back. I got my marriage back." That's what this is about. Not just performance, but quality of life, connection, and feeling alive in your own skin. So, gentlemen, here's what I need you to take away. 1 minute a day, one accessible spot on your own body. Consistency over intensity. Most men see real change between 4 and 8 weeks. Your timeline might be different, and that's okay. Your body will respond in its own time if you stay consistent. Don't compare yourself to anyone else. This is your journey. If this video gave you hope, hit that like button right now so more men can find this information. Share this with someone who needs to hear it. And drop a comment below. Tell me, are you going to try this tonight? What's one thing that surprised you? I read every single comment because we're not just a channel. We're a community of men who refuse to accept that decline is inevitable. This is Dr. Sophie Morgan, and I'm here to tell you something important. Your body hasn't quit on you. The tools for restoration are already in your hands. 60 seconds a day, one simple spot. Everything you thought was lost can come back. Not because of some miracle pill or expensive treatment, but because you decided to take control. Start today. Your future self is waiting.